Good morning, Hector. Good morning, Gisela. Good morning to all comrades who make possible this broadcast. And good morning to all those who tune in every morning. And we begin our briefing today stating that this is the sixth day we're not reporting fatalities in our country, something that really pleases us all, and it flatters all those who work to avoid the occurrence of deaths. There are 521 patients admitted in our hospitals, 313 suspects, 200 confirmed, and these are the active cases, and we have 8 people in surveillance, in observation by our primary healthcare system, by our specialists, doctors, nurses. There are 2,036 people being observed due to some epidemiological risk or because they are quarantined after being discharged. Yesterday, more than 2,000 samples were studied in Cuba. 2,015 samples were studied. In the Pedro Curie Institute of Tropical Medicine Laboratories, 917. In the Provincial Center of Santiago of Havana, 281. In Santiago de Cuba, 279. In Villa Clara's laboratory, 156. In the Ameijeras Brothers Hospital, 194. And in the Biotechnology and Genetic Engineering Center, 188. As a result of the study of these 2,015 samples, 14 tested positive for COVID-19, for 0.7% of all the processed samples. Cuba already accumulates 114,464 samples that have already been analyzed for the detection of COVID-19, and of them, 2,133 people, 1.9%, have tested positive. Of the 14 cases confirmed yesterday, as it has been happening in the last few days, all are Cuban. 13 of them are confirmed case contacts. Only in one case it was not possible to determine the source of the infection. And in this way, in the behavior of the pandemic in Cuba, 90.6% of all patients who have tested positive in Cuba, 1,897 people, are contacts of confirmed cases. Yesterday, I repeat, there was one person whose source of infection and has not been established, and there is a correction to be made because of the cases we were reporting until yesterday that remained without the identification of their source of infection. The investigation continued, and today we have 62 people whose source has not been identified, and we continue searching in order to perform the control measures required. With a source of infection abroad, there are still 133 people, 6.3% of the diagnosed cases in Cuba. Of the 14 new cases diagnosed yesterday, 12 are male, and this makes that the male sex accounts for 49.9% of the pandemic, with 1,065 people from the male sex. And yesterday, 2 were female, and this sex already accumulates 1,068 cases. 92.8% of the 13 of the 14 new cases were asymptomatic. And I think that I had previously made a comment on a possible mutation of the virus, but this has not been demonstrated. What is really true is that there is a noticeable growth of people diagnosed with the disease who are showing no symptoms. And this should lead us to be very cautious in our behavior and in the management of the lifting of the restriction measures, which, as we have also stated, many of them have come to stay. So at this point, 1,124 out of the 2,133 positive cases diagnosed have been asymptomatic at the time of the diagnosis. That is 52.7%. The age group with the most cases were the group of 40 to 59 years with 8 cases, 57.5%, followed by the group of 20 to 39 years with 5 cases for 35.7%. Today, like yesterday, no children were diagnosed yesterday, and we have a cumulative total of 235 children diagnosed with the disease, out of which 212, that is 90.2%, have been discharged with a satisfactory clinical evolution. By provinces, of the 14 cases confirmed yesterday, 12 are from Havana, that's 85.7%, distributed in 5 municipalities of the province, but 7 of these cases are epidemiologically related with the Alpha Pharmaceutical Laboratory transmission. The other 2 cases are from the province of Matanzas, one from the Matanzas municipality and the other from the municipality of Limonar. And with this outcome, Havana stands in the first place with a positive rate per 100,000 inhabitants of 9.13%. Matanzas in second place with 2.92 rate. Artemisa in third place with 0.97, and Ciego de Ávila with a rate of 0.69. And as I said yesterday, 11 provinces and the special municipality of the Isle of Youth for over 15 days have not diagnosed any confirmed case of COVID-19. I'm referring to Pinar del Río, Mayabeque, Villa Clara, Cienfuegos, Santi Espíritus, Camagüey, Las Tunas, Holguín, Granma, Santiago de Cuba, Guantánamo, and the special municipality of the Isle of Youth that for more than 15 days have not diagnosed any case of COVID-19, although they have not stopped conducting studies to detect the disease. And I emphasize this, and I think I have said this before. Some people still say that no new cases are detected because there is a lack of studies. Studies on risk groups and population studies are conducted in all these territories, but they have not uncovered any transmission of the disease. Of the 2,133 patients diagnosed in Cuba with the disease since March 11 until yesterday, 200 are still admitted as active cases. And the increase in number is a result of the confirmed cases we have had in the last few days. Of the 200 people admitted, 98.5%, that is 197, have a stable clinical course. We always regret the death of 83 people as a result of this disease in Cuba, and that gives us a lethality of 3.89%. And with this lethality, the island remains in 17th place in the region of the Americas. The region's lethality is of 5.58%, while Cuba stands at 3.89, remaining on the 17th place. There is a group of countries with a high lethality rate in our region: Mexico with 11.58, Ecuador with 8.51, Canada 8.06, Brazil 5.57, and the United States of America with 5.79. We always mention in our data the two patients that were evacuated at the beginning of the pandemic in Cuba. There were 9 discharges yesterday, fewer than the confirmed cases, and this is not favorable. But we know the reason of these new cases, which concentrate primarily on the local transmission in the ICA laboratory. Thus, with yesterday's 9 discharges, 1,848 patients have recovered, and they are back home under observation or have returned to their normal lives. And we report 3 patients in serious condition today. Of these 3 patients, 2 are admitted in the Salvador Allende Hospital and 1 in the Pedro Curie Institute of Tropical Medicine Hospital. 1 patient from the Salvador Allende Hospital showed some recovery and is currently considered in guarded condition. The data coming from the world are not encouraging. 185 countries continue reporting COVID-19 cases. Yesterday, there were 126,744 new cases, totaling 6,475,644 cases. And yesterday, 5,734 people died in the world in one single day, for a death toll of 386,544 deaths, for a lethality of 5.97%. The region of Americas yesterday confirmed 72,102 people with COVID-19, and now it totals 3,091,206 confirmed cases, representing 47.74% of the total of cases that have been reported in the world. Yesterday, 4,143 people died in our region, for a total of 172,407 deaths, and that, as I said earlier, that gives a lethality of 5.58%. We stress this international data because in spite of the evolution of the disease and of the new set of discoveries that presumably would help to the control of the pandemic or to its elimination, however, we see that the numbers do not decrease, and that really represents a real threat for the world because of the prevailing transmission risks and the spread of the disease in certain territories. And as I always say, Cuba has the advantage of not sharing land borders. So the increase here would necessarily be through airports or seaports. And as we know, there is a host of control measures implemented and surveillance on the people who enter our country that would allow us for the immediate detection of the disease.